Johnson, and today we are going to be discussing the diagnosis, treatment, and rehabilitation of a very common condition known as sciatica. Sciatica is pain down the leg, usually the full length of the leg, because of all the nerves that come out of the low back, the sacroiliac region, therefore called the lumbosacral and sacroiliac region and plexus, and it forms this big, long, huge nerve right here called the sciatic nerve. Now, it's a generalized term, sciatica. It also is synonymous with lumbosacral radiculitis, and it can be caused by herniated disc out of the lumbar spine, bulged disc out of the lumbar spine, misalignment of the actual sacroiliac joints, these big joints right here, big pelvic bones. So there's a whole number of issues going on with that. So we'll cover that today, as well as how we analyze and treat this problem. Okay, let's face the mirror there for me. And Cornell, I'm going to have you close your eyes and flex your head forward all the way and backwards all the way. And right now we're analyzing his posture three-dimensionally on the x-axis, the y-axis, and the z-axis, as we always do. And I can see his head still a little bit forward and translated to the right with the high left shoulder here. And down his pelvis, his thoracolumbar spine, as well as the sacrum and pelvic spine, has actually translated on the x-axis to the right. So let's do this first. Let's go ahead and put you on here and decompress you. Now, we've looked at his MRIs that he had done from the orthopedic surgeon. You got this first in November?
Oh, yes.
Of 2013 is when he started feeling the pain and problems. And what did you do first thing? Go to your medical doctor?
No, I went to another chiropractor.
Okay, you went to another chiropractor, and then what happened?
I went 2 times.
He went 2 times to the other chiropractor, and did the chiropractor adjust you, or did you just do therapies?
Did some adjustments and some therapy.
Yeah.
The condition seemed to gotten worse.
It actually worsened your condition?
Yes, sir.
Was he doing that adjustment where he has you on your side and twists you and rolls it?
Yes, sir.
Yeah. Now, if you look here, see we have very little patellar reflex. This is pre-adjustment. Yeah, there's just not much there. But I'm going to take just an ordinary white thin bath towel. And we're going to fold that up just right to where I can get it directly under his occiput. Okay, there we go. Good. Yeah, there we go. Okay, now just a deep breath through your nose. And just relax everything. Yeah, got one more here. That's it. There. Now, did you feel that all the way down?
Yes, sir.
Okay, good. Now just lay there and relax. Okay. We actually got a lot better reflex off the left one, and we still got some work to do over here on this one. So we keep analyzing the patient as we go along. Now this is just a Palmer package, master cervical adjustment bilaterally to open up his facet joints and create a proprioceptive neurological bombardment that goes into his brain and helps change the pain gate. Okay. By the way, our audience over here are his beautiful children. Okay, let's come over here and have you on your tummy. Now, always put the head down a little bit so that we can spread the upper and mid-thoracic vertebra apart. There we go. Now, remember I said sciatica could come from lumbar disc or sacroiliac problems. Now, his left leg is short by about 1/4 of an inch in this position. Now, when I bring it up, it gets exactly even, and that tightens up right there, doesn't it?
Yes, sir.
Right down his low back and pelvis. See, that's called just a Deerfield leg check, and when I brought his legs up and he had more tightness and pain here, it's called a knockless test, orthopedic test. That tells us that he does have a lumbosacral sacroiliac lesion because the legs actually got even. Positive Deerfield. So we know he doesn't have a leg that's anatomically short. is actually functionally short, meaning that his pelvic bones have misaligned, which I just adjusted those for. There's L4. Now there's L3, that one's pretty tender. There's L2. And there's L1. Now see, he's just now starting to get back a little bit of that forward lumbar curve, or lordosis, as where before, this whole spine down here had flattened out, so you couldn't tell the difference really between here and here, because he had muscle spasm that was flattening the lumbar spine out. So what we're doing with the decompression on the y-axis is taking compression off of the disc, off of the joints themselves, and creating an intradiscal vacuum that helps suck the nucleus back up into the disc and reduce the amount of the disc herniation or bulge, whichever the case may be. Usually bulges first, and then herniations happen when you have a sudden anterior weight-bearing load on the disc, and then the disc explodes backwards. Now you notice I keep adjusting his sacroiliac joint, and I'm adjusting that one because it's posterior and it's internally rotated, so I'm doing exactly the opposite. I'm pushing it down, and I'm also adjusting the internal aspect of it. Now on this side, you see the line of drive is different on his left sacrum and sacroiliac joints. There. So, we come back down here, we reanalyze, and now the legs are exactly even. And I don't look at the very base, I look right where the sole meets the heel. And that's exactly even. And it stays even. I bet that doesn't hurt as bad as the first one. Is that right, or does it?
Much better.
Okay. He said much better, for those of you who can hear. Now, we get the Terminator out. This is my human meat tenderizer. We're going to get in there and break up the trigger points that have developed in this time and the pelvic musculature. And you notice I'm actually putting quite a bit of pressure on this. And then the hamstrings here too. We're not using any types of electrotherapy modalities or diathermy or other types of physical therapy modalities in this office. We do everything by hand, and I do all of it. So that way I know exactly what has been done, what needs to be done, and where we're going. A little tender right down here, huh? Right there, especially. See, but we are starting to get a little of that forward lumbar lordosis down here, so that's all good. Another test that we always do on patients to determine whether their pelvis is involved with sciatica is to evaluate. This is called the sacral deviation test, and I'm pushing straight down on the base of the top of his sacrum. I'm going to ask you to lock that leg straight and lift that whole leg, right leg off the table. Okay, good. Now let's put that one down, do the left one. Good. That was about the same on both sides. Did it hurt on either side?
No.
Good. So he had no sacral deviation, so that means we got his middle triangular shaped bone called the sacrum, which makes up part of the sacroiliac joints. I'm just going to put this plastic replica, I call him Bones. He's been with me for 33 years now. So this is the sacrum, the middle triangular shaped bone. This is an ilium, the right ilium. This is the left ilium. So definition, sacroiliac joint. It's the largest joint in our bodies, but it has a huge plexus of nerves that come out of it, go right through the buttocks, down into the leg, all the way down to the calf and into the foot. So I was telling you he had a misalignment before of being misaligned like that, and externally rotating him, which is why I was adjusting him that way. But on this other side, he had a different rotation, so that's why I adjusted it differently on the left side. But he has a herniated disc down in his lumbar spine on top of all this. So with the lumbosacral plexus coming out from L2 all the way down into the sacrum here, that goes nerves all the way down into his sciatic nerve here, he's got involvement of everything in that pathway. So we're going to make sure and treat everything in that pathway. And the next thing I'm going to have you do is just roll over on your back for me. There you go. Now this is an adjustment that I do on patients who have lumbosacral and sacroiliac conditions involved with sciatica. Just relax your knee here for me. There. Now you just got a really straight vertical decompression here on his right knee. Did you feel that up in your back as well?
Yes, sir.
Okay, good. So see, when you do that, you should get not only a traction in the knees, but also in the lumbosacral spine and sacroiliacs as well. Same thing, loosen. There we go. Now that one didn't get up as high, but did you still feel it up there?
Yes.
Okay, good. So we still got his knee there. Now on these patients, they're always going to have sore TFLs right here. Is that guy sore?
Not that much.
Not this bad on this one? This is good. This
that
side's worse?
Yes, sir.
Yeah.
Like that.
So you always want to do transverse friction on these. And then this is absolutely, bar none, the best exercise for a low back and sacroiliac condition creating sciatica. Push against me. Okay, and take a breath in and relax. Okay, now stretch it up further. Okay, now take a breath and push out. And there, as far as you can. There you go. Now relax and breathe in. See, I'm stretching that leg up further and further. Now push against me again. Yep, good. This is an active resistive exercise, and we're dealing with his hamstrings as well as his gluteus muscles as well as piriformis. So go ahead and push against me, but primarily hamstrings. Hard. There you go. Now relax. Okay, I keep lifting that up. Now push. Okay, relax. There we go. One more time. Yep. That's pretty hard to do too, isn't it? Yeah. You feel that stretching a lot in the back of your hamstrings there?
Yes, sir.
Okay, good. Let me help you up sideways here. We'll face towards your knee desk.
Okay.
There we go. Now, just look straight ahead for me for just a moment. Now, this really doesn't have anything to do with his sciatica, but he does actually have a subluxation process up in his right shoulder, glenohumeral joint, which causes a grinding or crepitus noise. So I am adjusting that joint. Okay, just relax this. Much better. Did you hear that one?
Yes, sir.
Felt that one too, huh?
Yeah.
Then we get down into the elbow, the radius and ulna coming down into the wrist, into the carpal bones. So we're adjusting his carpals, which is where you get carpal tunnel syndrome from, and his phalanges, which are his fingers. And then I compress the radius and ulna together as well as the carpal bones and pull straight out. That also opens up the carpals so that the median nerve can go through without being impinged. Okay. Just let this totally relax.
Yes.
There we go. Okay. Okay, now just straight pull, squeeze on this and pull directly out. Very good. Now, let's have you come back over here in front of the mirror. The next thing I'm going to do is I'm going to use an Atlas adjusting instrument right here. It's called the posture corrector. And what I'm going to do is I'm going to retrain his cerebellum or the hindbrain to hold his posture in a correct biomechanical weight-bearing configuration by mirror imaging him. So let's close your eyes and flex your head forward all the way. Remember what that feels like, backward all the way. And see, already has a much increased range of motion And he didn't go as far forward this time either, but he still has a little deviation. So his home exercise and therapeutic exercise is this. We have him pull the shoulders up with the trapezius muscles and back with the rhomboid muscles. Now bring your head straight back in the z-axis. Yep, like this. And then I'm going to translate you to the left because you were to the right. And now lean back. Okay, now I want you to shift your pelvis straight to the right this way. There you go. Okay, good. Now see, I have him in a exact mirror image of his current biomechanics. Can you relax again? And now, let's have you flex your head forward again, Cornell. Backward. And then neutral. Take a deep breath in. The range of motion was better, and does that look better on the posture from the side? Absolutely. See how his shoulders are squared off better now? Hands more towards his side, not so far out in front of him. Does that feel like you're standing up straighter?
Yes, sir.
How's your low back and pelvis and leg feel right now compared to before the adjustment?
Feels really good.
Good. Would you mind telling our YouTube video how you found us?
Well, first of all, I'd like to give all the glory to God
Yes, I second that.
for directing my steps and helping me find Dr. Johnson.
Absolutely.
Before I came to Dr. Johnson, I was in a lot of pain. I was limping real bad, and especially in my line of work, you know, fixing cars and bending over cars all day, it was really hard. I used to get very little rest at night, but just a few short visits, I'm back to almost normal again. So thank God. And
yes. And we give all the honor and glory to God too. And that's who
Amen.
brings all of our patients here.
Amen.
Yeah. And we're very happy that he's here, and we hope that you take advantage of us. You can go find us at www.advancedhoustonchiropractor.com. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.